I'm Suafiatu Habib Tunis. I'm a community activist. I would like to go back to after having my first child. My eldest is 26 years old now. I'm 52 years of age. When I had my first child, I was living outside the country and I said, I have to give space in between my kids. So there's a 5-year gap between my eldest and my youngest. I started having difficulties with my menses. It started becoming heavy. It was so bad and painful. And it got to the point where I actually stopped seeing my menses for almost a year. And at that time, since I was living outside the country, I took a trip to China where I was fortunate to go to one of their traditional medicine hospitals. They started treating me. They gave me some herbs that I was taking. So thereafter, I started seeing my menses again. That's when I discovered that you can be as young as 25 and get into menopause. After the treatment, the menses were coming, but it was so heavy, and I started feeling bloated. Every time I'll feel like I'm pregnant and I'm not pregnant. It's got to a point that I had to relocate back to Sierra Leone. When I came back to Sierra Leone, that's when I was told by one of our family doctors that I should go do scanning, because whenever I had intimacy with my husband, I used to bleed out, even when I'm not on my menses. That journey was very, very difficult because every time we talk about intimacy, I have to feel worried that, instead of me getting or reaching orgasm, I'm going to be bleeding out. I had to go do the scanning and they discovered that I had fibroids. It was 5 or 6 of them, and I was still struggling to have a child. I was deferring the surgery. I said, okay, since it's not as big as, we were thinking, let me just try to have another baby. So I had my second child. It got worse because whenever I was seeing my menses, it was like, it was meat that was coming out of me, because that was how thick the blood was, just like liver, every time. So it was very, very serious until I finally did the surgery. Yeah, the signs were heavy bleeding for me, and whenever I see my menses, the thickness was like meat. It was just like liver. Some days I would just, if it's my time of the month, when I wake up, just splash, on the ground. And it was really bad and it was painful, very, very painful. Some days it was so painful that sometimes I'm not able to do anything. I'll be like, for that 1 week, just at home. I can't go out, can't do anything. And what really blessed me was that I have girls. So they understood what I was going through, because I always tell them, you are also going to go through similar. You have a child and, you'll get to the point where I am. So they understood. So most times they help me to clean, because some days I'm not able to do anything. My body tried to give me so many signs, but sometimes, we take our health for granted. As women, we were taught that it is okay to go through pain. It is okay to go through childbirth. Even when you are having intimacy with your partner, you are not allowed to say, I'm feeling pain. It's like, it's normal. When you say, I'm feeling pain, they will say, oh, you are enjoying it, you are pretending. So my body was sending me the message, because I feel bloated, and I go through these pains, but I was accepting it as normal, and it's not. Unfortunately for me, I lost my mom before I started having all of these, issues. So there was really no one that I could really talk to. You know, I had sisters, cousins, friends, but like to really, it was always superficial. Oh, there are a lot of fibroids around. People are having fibroids. We see women with fibroids. But the headspace, or my headspace, nobody asked me how I was feeling mentally. It was just like a chore to get it done and you move on, because, you know, that's how we see other women go through. Well, I would say my daughters, more especially the youngest one, because the what broke the camel's back for me to really go for the surgery was when I woke up one morning. As soon as I got off the bed and I was bleeding, and it was so thick, you would feel like it's, you know, cut meat that was coming out of my body. And I broke down and she told me, "Mommy, don't worry, you'll be fine." And she cleaned up, you know, so she is a person that really understood what I was going through, you know, and I believe even though she was younger at that time, she heard me because she was very, very gentle with me. We have been taught that I think having a child or childbirth or labor is the worst pain that any woman can ever go through. You know, even more than, I would say, the Bondo society that I went through. You know, that one, I've been taught that having a child going through labor is more painful than that. So when the doctor told me that I have the fibroids, and at that time it was very, very small, and up to the time I finally decided to do the surgery, it was this big, you know, and with a lot of pain, a lot of blood and stuff like that. I just wanted to get it over with, you know. Oh, I think I am focusing more on myself, on my womb, because I did a lot of research, and even though I think that my womb was not treated fairly, because we did what you call subtotal hysterectomy at that time, and my family was never told that, you know, the specimen or what was removed has to be tested, you know, to check if it was cancerous or not. So that is the fear that I have at the back of my mind, that maybe something will come up again, because from that time they did the subtotal hysterectomy, I stopped seeing my menses. At that time, I was in my 40s when that happened. So far, health-wise, I have been good, but I always have that fear at the back of my mind that, you know, because I hear different stories. It's a total removal of the womb is best. And I did subtotal, you know, so there's still a piece of my womb there. So I don't know. What has helped me to heal really has been just learning and knowing that I'm not alone, because when that part of your body has been removed, it changes the whole biology of your system, because my moods change. Now I'm actually totally in the menopausal stage now, because when it's happened before, perimenopause, I was having different feelings. I get angry, I'll just sit and cry. You know, a lot of things were, you know, going through my body. Some days I'll feel horny, some days, you know, different things just came crashing down after the surgery. You know, but now my body has adjusted to everything, and, you know, I'm looking after my health more than before, and my womb so far is not giving me any issues. So I think for now we are good to go. Well, what I would say to any other woman who is going through similar situation, or who is having fibroids, or who might have hysterectomy, subtotal, or any uterine health issues, I would just say, be good to yourself. Look after your mental health and just love yourself some more. Because sometimes we forget that we exist as women. Oftentimes we tend to focus on those that are around us, the little people that we have to take care of, and forget about our own health. So for me, I'll just advocate that we look after ourselves some more, we pay more attention to ourselves, and, I think whatever you are going through, the medical side aspect is there, but your mental state is much, much, better, because you need to be in a proper headspace. If my wound could speak, she would say, I hear you, I saw you, and I will do better next time. I will take better care of you.